Hi, Alvin DeLeon here, and you are watching episode 62 of the 3-Minute Health Tip. And in this episode, I'm going to talk about chronic arthritis. So if you are watching this right now and you're suffering from some sort of joint pain, whether it was a neck issue, a shoulder issue, a knee issue, a lot of the times the arthritis diagnosis comes about because you had an original trauma in that area. Maybe you fell off a horse when you were 15, or you played sports and you were playing hockey or baseball, and so you've got a rotator cuff or shoulder injury from back then. Or maybe you were in a car accident, and ever since that incident or physical trauma, your joint never seemed to heal, and now you've been diagnosed with this chronic arthritis, and it's actually measurable, where they're able to see that there's bone growing in that joint space known as an osteophyte, or the space between the joints are actually getting smaller and smaller, and there's an inflammation there causing the pain. We're going to now look at that from a G&M perspective. Understanding the biological laws, we realize that the changes in that joint are meaningful, that it's part of the ulceration and rebuilding process of trying to make that joint more stable or stronger than it was before that accident or incident. The reason that the changes don't resolve or that the pain continues partly is because you're in a hanging healing. We learned about the two phases in biological programs, and that most of the time the joint pain or the inflammation occurs in the healing phase as the body's trying to heal. However, for many of us, when we feel pain, we start to devalue that joint or that area. Partly because we expect that maybe the pain was going to go away after a couple of weeks, and after 3 or 4 or 5 weeks, the pain's still there. That leads to this further devaluation that allows us to never fully close that biological program, because the pain itself becomes a track or a trigger for us, making us think that it's still not healed, and so the joint itself tries to ulcerate and rebuild stronger than it was before, leading to this vicious cycle of chronic arthritic pain. And so how do we stop this cycle? Well, the health tip for today is to get you to recognize that pain equals healing. Just like when you sprain your ankle or when you break a bone, the swelling, the inflammation is actually in the healing phase as those tissues are trying to rebuild and strengthen. And so the next time you're dealing with your shoulder pain from that baseball injury 15 years ago, or your knee pain from that fall off that horse 20 years ago, I need you to get yourself in the mindset that the pain is a sign that the joint is healed, that your body has recovered from that injury, that it takes less than a few months for your body to completely recover, but it depends on your expectation. If you were hard on yourself, that you didn't get better as soon as you wanted to, that could have led to a further devaluation, and then the pain itself makes you feel like something's not quite right with that joint. And so to overcome chronic arthritis, we have to recognize that your body is healed, and that the pain in and of itself shows up in the healing phase, that it's still trying to heal. When you're dealing with your pain, or when the pain flares up, it's important to remind yourself, this is good, this is a healing symptom. You can put some ice on it, you can rest, you can relax, minimize or be flexible with your expectations about that pain going away, so that you can finally close that biological program. So remember, this health tip: healing equals pain. Your body has dealt with that injury and it's finally recovered. You just need to close that biological program, not devalue that part of the body, so that it can complete and the pain can slowly minimize and resolve. Thanks as always for tuning in to this health tip, and I'll see you at the next episode.